The infertility patient electronic medical record developed by Robosoft technologies. So here is the icon for OriginIVF. So I've just clicked that. So by default, this is the landing screen which shows all the registered patients for the center at any given point in time. So these are individual cells which shows the patient records. So since they come as couples, so you will see the male and female patients or couples. And you can also, here is an icon which shows basically if there are multiple centers, you can also search for a particular patient by typing the name here. Here is the button to add a new patient. So let me just add a new patient. So you got to mention all the patient name and the demographic information like address and phone number and things like that. Here is the infertility number which automatically gets created, and hospital ID is something which can be mentioned by the hospital. So let me just go back to all patients. Now let me just open one of the existing patients so that we can look at the filled in information. So here patient name and hospital ID, infertility ID, age, trying to conceive since, and married since, and all of these important fields are mentioned. And here is the print icon which will actually print a card for the patient which will include hospital ID, name, and the important information. So let me straight away go to the case history. So this is the first step when a patient visits the doctor. So during consultation this particular form is filled. So infertility since how many years, whether it's a primary or a secondary infertility. If it is secondary infertility, then duration of secondary conceiving, married since how many years, staying together or not. See, most of the fields are like you don't have to enter anything, it's just a click whether yes or no. If it is abnormal, then in that case you can mention more information. For example, here menstrual history, if it is normal, we can for abnormal, then you can mention more details here. Dysmenorrhea, yes or no. Then last menstrual period date. Obstetric history, whether there is abortion or preterm delivery, ectopic pregnancy, term delivery, or what is the last pregnancy date. Post-abortal, post-delivery complications, if any, if it is not applicable, or no, or yes. If it is yes, then more details. Medical history, whether it is diabetic, thyroid, hypertension, cardiac, others. Surgical history, myomectomy, ectopic pregnancy, endometriosis, appendicectomy, laparoscopy, or others. Previous history of infertility treatment. Number of ovulation cycles, OI, how many. OI details, medication used, whether it is CC or letrozole, anastrozole, and so on, or a combination. Then you can mention response, folliculogenesis, whether it is poor or good or unknown. Then IUI, whether IUI is done or not. If yes, then how many cycles. Then previous ART. If no, never done before, then in that case no. If it is yes, then how many cycles. Say let me enter 3 cycles. Then you will see 3 tabs here to enter the details. So for the first tab shows the date of the ART performed, the type of ART, whether it is IVF, IVFD, ICSI, ICSI-D, or donor egg IVF, or FET. Then type of OI protocol used, agonist or antagonist. Then type of gonadotropin used, recombinant FSH, HMG, pure FSH, and so on. Responder, whether it's good or a poor responder, number of oocytes, the number of embryos transferred, number of cryopreserved, quality grade 1, 2, or 3. Then a result, whether it is failure or success. Then you can mention the same thing for second and third time as well. Previous investigations, you can mention endometrial biopsy, proliferative or secretory, then USG, HSG, hysteroscopy, laparoscopy, transvaginal sonography if it was done, then tuberculosis, positive or negative, treated or not treated, then other investigations. Then you can add more if it is relevant to your particular clinic. Then blood, blood test reports from earlier visits to other centers. Blood sugar, FBS, PPBS, FSH, basal, blood sugar, RBS, LH, E2, prolactin, T3, T4, TSH, AMH, and if any advice or plan given by other centers. Similar way, for the husband, job, smoking, whether alcohol, and coital problems, if any, previous surgery, other medical conditions, then basically the semen profile for any particular date, semen volume, sperm concentration, total numbers, total motility, progressive motility, normal forms, vitality, pus cells, if any, then immature germ cells, and what was the advice and plan given by the other center. Now, evaluation for this particular center. Let's look at what are the things to be captured for wife: height, complexion, blood group. Then on examination, general exam, weight, height, BMI, breast, thyroid, sign of hirsutism, PA findings, PV findings. Then investigations. Previous is something which is coming from the case history, and current is what has been entered in this particular clinic. Again, similar parameters like EB, USG, HSG, and so on. Then you have again blood parameters. Again, old observed value is coming from the case history, and current findings is coming from the lab of your center. So here you would mention what is the advice and plan for the patient, and then you will also mention what is the ART type that you recommend, like IVF, IVFD, ICSI, ICSI-D, donor egg IVF, or FET. Then for the husband, again, general details: height, complexion, blood group, and then parameters for a semen profile. Then here for current findings, pre-wash and post-wash. Old observed value is coming from the lab test conducted in other center. Then again, you can mention the advice and plan. So now let's straight away get on to the ovarian stimulation. So when you press upon ovarian stimulation, you've got to mention whether it's a long protocol or antagonist. So once you mention the long protocol, or then set the date here, the first date of the stimulation, and then the rest of the dates are automatically calculated. Then you can mention whether it is analog or antagonist, then FSH and HCG values, along with E2, LH, and progesterone values. Then how many right ovaries, how many follicles tapped on right, on left ovary, and endometrial thickness. So this is a very simple form. If at all, we have also given an option of folliculogram. Okay, well, let's look at that. So in folliculogram, what happens is, for any of the cycle day, you can just click on 2 here, the second stimulation day, and here you see all the the size is mentioned, size of the follicle, and then you can mention how many number of follicles. For example, number 4 number follicles with the less than 10 size, and similar way you can basically mention the number of follicles tapped. Then automatically all the follicles will be the number of follicles and size will be automatically plotted. You can take your mouse over this, and you would see the date on which it's tapped and the size of the same. And number of cross marks indicates, in blue indicates the follicles tapped from left ovary, and the amber shows from right. And you have space to mention what is the blood or FSH, progesterone values, and drug dose, then estradiol and ET, and scan by details. So let me just go back, and there is another chart that we have provided, which will basically plot the E2 and progesterone values. So basically you can look at this graph, and you can take your mouse over this to see the actual values here. You can also look at what is the R type that is used, and what are the egg details, follicles. So let me just come out of this. Now let's look at the egg retrieval. In egg retrieval, let me go in edit mode. You have date and time, sedation or anesthesia, catheter used, single lumen or double lumen, number of follicles tapped, right ovary and left ovary, how many, number of eggs recovered, negative pressure if any applied, and so on. And then insemination, semen profile, date and time, source. Let me just go in edit mode. Frozen, thawed ejaculate or fresh ejaculate, or testicular sperm or testicular sperm, frozen, thawed or epididymal, fresh and frozen, thawed or donor sperm. You can mention the source here. Then volume, density, motility, sperm wash method, medium used, and outcome. And if it is a conventional way, then in that case again, date and time, in vitro maturation time, number of eggs inseminated, mature, immature, post mature, number of sperm, fertilization medium, and insemination end. Then if it is ICSI, then in that case, date and time, metaphase 2 oocytes, metaphase 1 oocytes, GV objects, GV oocytes, and then comments. Okay, let's look at fertilization. Fertilization is a read-only page which directly gets populated from the embryology page. So when we look at embryology, we would know how these number of embryos are calculated or eggs are calculated. So total number of eggs, maturity M2 how many, fertilization 2P and 2PB how many, then embryo grade 1, grade 2, grade 3, transferred with hatching, transferred without hatching how many, and cryopreserved how many. So that's what it. So let's look at embryology. Embryology, for each of the eggs you can mention, see there are two ways of making entries here. For all the eggs you can mention together, which I'll show later. And now let's look at one by one egg. So egg number you can mention, egg image you can upload, then maturity, GV, M1, M2 or post mature, or morphology, normal, granular, inclusion bodies, large size, fragmented polar bodies, large PB space or thick zone, you can mention that. Then fertilization, whether it's 1PN, 2PB or 2PN and so on. And then fertilization day by day, how many, what is the grade. You can also mention survival, and you can mention any history related to the egg, whether it is cryopreserved, then in that case you mention the location and other details. There is another way to make entry, which is easier way, which is go to summary. In summary you can, it's another view of the same thing. You can basically go in edit mode. In edit mode, for you can mention the morphology. If you just click here, you can show, all the details are shown. You can just you just have to click whichever is relevant. And then you have maturity. You can select what is the maturity, and then day 1 you can just set the date here, and the rest of the dates are automatically calculated. You can mention the time, and for day 1 you can mention the fertilization, and then for day 2 onwards you can mention how many cells and what is the grade. So on for grade 3, 4 and 5. Then you can mention the status, whether it's cryopreserved or whatever it is, and then you can mention the outcome. So is the case for the rest of the cells as well. Let me just save this. So this is the overall view. So basically you can look at the number of cells and grade for any given date, and then you can also upload images, and you can look at everything. And if you want to look at any particular egg, for example 3, so you can look at the individual details in a very detailed view along with the image. Yeah. And now let's okay, there is another option, which is, let's go to summary again, condensed view. It basically shows the details. It's a analysis the software does by maturity, how many GV, M1, M2 post mature, and how by fertilization, then by survival, and then by grade, then by status. So these are the different views that you can use. Then let me go to embryo transfer. So here there is mock transfer, difficulty, difficult or easy procedure. Then cervix was held or not held. Then embryo transfer, date and time, day of transfer, number of embryos, embryo quality, number of attempt, catheter, then transfer, blood at the tip or not, mucus, procedure, easy or difficult, the name of the embryologist, clinician, witness name, and comments if any. Then luteal support. In luteal support, basically, you can prescribe multiple drugs. You can use this template feature to create new templates, and for any new prescription you can just use the template option, which will add multiple drugs in one go. You can create your own templates. Let me just cancel this. And then you have outcome. So here you can mention whether it's a chemical pregnancy or a clinical pregnancy, date, beta HCG. If it is clinical, then in that case, date, number of gestation sacs, number of fetus, fetal reduction if any, and then date, gestation, age at reduction, number of embryo or fetus reduced, and comments if any, then progress, first, second, third trimester, any problems during pregnancy, then delivery, date, weeks, weight of baby, sex, delivery type, and any problems during delivery. And then if at all there are any OHSS cases, then in that case you can mention that as well. We have a superset of all the OHSS parameters mentioned here. And then we have reports. Here virtually you can create any of the reports, because we have provided you access to any of the fields that you might feel necessary. For example, by art type, if you want to find out how many IVF cases, IVF-D, ICSI or ICSI-D cases, then patient details, you can find by gender, by age, by blood group. Then by case history you can mention the patients who are whose menstrual history is abnormal, or say dysmenorrhea, yes, or virtually any of the fields. Say for example, a patient who has got, whose surgical history has myomectomy or ectopic pregnancy or endometriosis and so on. Then by evaluation, basically we have provide or luteal support. Basically you can mention any of the medicines and it will tell who are the patients who have gone through such medicines, who have taken such medicines. Let's take an example of a case history. If at all we want to find out any of all the patients with the tuberculosis positive, let's do a add filter and view report. Basically it will show all the patients with the tuberculosis positive. Okay, so let's go to download EMR. That's an option provided for the doctors to basically see the entire information that is filled for the patient in one single page. So once you press download EMR for any patient, it will basically show a snapshot of everything that is entered in the system, which includes stimulation protocol, ultrasound details, then oocyte pickup details, insemination details, fertilization, embryo transfer details, and outcome. And there is a patient copy. Patient copy will hold only those details which the patient need to see, and not everything that the doctor's copy has. So similar way, we have IUI details as well. We have mentioned up to 6 cycles here. So basically you can go to any of the cycles and you can mention the drugs here, and then IUI, just a minute, edit mode. So basically you can mention the date, stimulation day, ET, number of right follicles, left follicles, sperm dynamics, BSU, ASU, count with count and motility, and the action taken. So this is what you can mention for individual cycles. So I think with that we come to an end of this brief demonstration. There are a lot of other features which is part of the settings, and we can customize it as per your requirement. But anyways, I think with this we can conclude this particular demonstration. Thank you for your time.